Hello, all. Thank you, Mental Health America, for the opportunity to share the Mind the Gap initiative. An initiative to ensure perinatal mental health is a national priority. On behalf of Postpartum Support International, I'm Colleen Reilly, president of the Reilly Group, and I also serve as director of Mind the Gap. I want to give a shout out to my friends and colleagues from the Mental Health America Network. As a former MHAer, I've had the great honor of working with leaders across the country, and I'm always inspired by the excellent work that you do. Postpartum Support International, or PSI, is leading the Mind the Gap initiative in partnership with Mental Health America and other professional and advocacy organizations. If you don't know PSI, I really urge you to connect with them. They are the largest organization devoted to perinatal mental health, with chapters in every state across the country. PSI offers education and support groups to families at no cost in English and Spanish. They provide training to frontline healthcare workers. They advocate for policies through the Mind the Gap initiative. This initiative is a coalition of 30 organizations who've come together and outlined policies in a recently released national report. The report includes a gap analysis and actions that together we can take to bridge those gaps. So what are the gaps? Perinatal mood and anxiety disorders are the #1 complication of birth, and this is not generally known. The Centers for Disease Control and Prevention have reported that untreated mental health conditions were the second leading cause of death in women 43 days up to 1 year after delivery. 50% of women who even get a diagnosis do not get treatment. Women with untreated depression are at risk of delivering premature babies, and postpartum depression hinders infant bonding and attachment, leading to developmental disorders. Untreated and unaddressed, these mental health issues not only affect women, they have a cascading impact on the health of infants, children, and families. We can do so much better. The coalition came together and reviewed the landscape analysis to determine policy recommendations going forward. Some key policies include increasing awareness about the impact of untreated perinatal mental health among policymakers, increasing investment in training and educating our healthcare workforce, establishing a maternal mental health 24-hour hotline, which is a current bill in Congress, ensuring perinatal mental health care is a priority in public and private insurance, and Medicaid covers women a full year postpartum, and coverage means that women are routinely screened during pregnancy and postpartum and have access to a diagnosis and treatment. Another important legislative opportunity is the Momnibus legislative package, which is promoting Black maternal health and mental health in 2020 and beyond. The package includes 9 specific bills, such as a bill led by Congressman Joe Kennedy focused on maternal behavioral health care. PSI and the Mind the Gap Coalition are working together to make these policies a reality through hosting coalition meetings to tackle advocacy actions. The Mind the Gap initiative is also convening state meetings to engage stakeholders, build awareness, promote best practices in healthcare systems, and galvanize community engagement. We invite you to join us. Go to postpartum.net to get the Mind the Gap national report. Share it with your colleagues to help spread the word. And when you're at the site, please sign the pledge to support mothers, infants, fathers, partners, and families' mental health and well-being. By signing the pledge, this will be a way for us to contact you to join us in advocacy and be a part of the state meetings. We look forward to collaborating with you. Thank you for your time. Thank you for this opportunity to be with you. And thank you for all the work that you're doing to support mothers and families.